Shut up and sit down.
Essay on COVID-19. Essay on coronavirus. COVID-19 essay for students and children in English. Coronaviruses are a family of viruses that can cause respiratory illness in humans. They get their name, corona, from the many crown-like spikes on the surface of the virus. Severe acute respiratory syndrome, SARS, Middle East Respiratory Syndrome (MERS) and the common cold are examples of coronaviruses that cause illness in humans. The new strain of coronavirus, COVID-19, was first reported in Wuhan, China in December 2019. The virus has since spread to all continents except Antarctica. The number of people infected changes daily. Organizations that collect this information, including the World Health Organization (WHO) and the Centers for Disease Control and Prevention (CDC), are gathering information and continuously learning more about this outbreak. As of this writing, 5/11/2021, more than 15 crore 90 lakh people in the world have been infected. Over 33 lakh people have died. Some 192 countries and territories on all continents except Antarctica have now reported cases of COVID-19. The US has the highest number of cases with more than 3 crore 20 lakh people infected and over 5 lakh 80,000 deaths. India has nearly 2 crore 30 lakh cases and 2 lakh 50,000 deaths. Brazil has more than 1 crore 52 lakh cases and 4 lakh 20,000 deaths. France has over 58 lakh cases. Turkey has over 50 lakh cases. Russia and England have over 44 lakh cases. Italy has more than 41 lakh cases. Spain and Germany have over 35 lakh cases. Argentina and Colombia have more than 30 lakh cases. Poland and Iran have more than 26 lakh cases, and Mexico has over 23 lakh cases. For the latest statistics, see the World Health Organization's situation reports and Johns Hopkins Coronavirus Resource Center map reference at the end of the article. COVID-19 is likely to spread when the virus travels in respiratory droplets, when an infected person coughs, sneezes, talks, signs, or breathes near you within 6 feet. This is thought to be the main way COVID-19 is spread. When the virus travels in small respiratory droplets that linger in the air for minutes to hours from an infected person who is more than 6 feet away or has since left the space, this method of spread is more likely to occur in enclosed spaces with poor ventilation. From close contact, touching, shaking hands with an infected person, by touching surfaces that the virus has landed on, then touching your eyes, mouth, or nose before washing your hands, not thought to spread easily by this method. COVID-19 enters your body through your mouth, nose, or eyes directly from the airborne droplets or from the transfer of the virus from your hands to your face. The virus travels to the back of your nasal passages and the mucous membrane in the back of your throat. It attaches to cells there, begins to multiply, and moves into lung tissues. From there, the virus can spread to other body tissues. Governments, health agencies, researchers, and healthcare providers are all working together to develop policies and procedures to limit the spread of this virus, both globally and from individual to individual. Researchers are still learning about COVID-19. What is known is that people infected with COVID-19 can spread the virus to others before experiencing symptoms themselves, while people are still asymptomatic. Once do you have symptoms, the CDC says you are no longer contagious 10 days after your symptoms began. Until everything about COVID-19 is fully understood, the best advice from healthcare providers to remain safe is to stay 6 feet away from others whenever possible. Wear a cloth mask that covers your mouth and nose when around others. Wash your hands often. If soap is not available, use a hand sanitizer that contains at least 60% alcohol. Avoid crowded indoor spaces. Bring in outdoor air as much as possible. Stay self isolated at home if you are feeling ill with symptoms that could be COVID-19 or have a positive test for COVID-19. Clean and disinfect frequently touched surfaces. This so called incubation period, the time between becoming infected and showing symptoms, can range from 2 to 14 days. The average time before experiencing symptoms is 5 days. Symptoms can range in severity from very mild to severe. In about 80% of patients, COVID-19 causes only mild symptoms. Persons at greatest risk of contracting COVID-19 are people who live in or have recently traveled to any area with ongoing active spread, people who have had close contact with a person who has a laboratory confirmed or a suspected case of the COVID-19 virus. Close contact is defined as being within 6 feet of an infected person for a cumulative total of 15 minutes or more over 24 hours. People over age 60 who have pre existing medical conditions or a weakened immune system.